I'm Marianne Dalzell, past clinical director of the Rehabilitation and Exercise Oncology Program, Hope and Cope at the Siegel Cancer Centre in Montreal. I'd like to now address the topic of what do I do when I know that I'm at greater risk due to my cancer treatment or due to the type of cancer that I have, and what can I do about it. And one thing you should not do about it is rush to your doctor and become panicked, become overly concerned about your bone health. I think that's a very important thing to say because there are very clear steps that you can take in order to manage this yourself. Number one, if you know and if you've been told that as a result of what I said just previously on looking at who might be at risk, if you know that you're at greater risk, the first thing that you should do is ensure that you have a bone scan of some form, that you have a DEXA to look at the state of mineralization of your bone and test for osteoporosis, basically. And I think that's very important. Anyone, any woman, particularly pre or postmenopausal, that has treatment for breast cancer is very vulnerable to this bone demineralization being increased as a result of their treatment. So first and foremost, have a DEXA, and at that point, or have a test that would give you your percentage of bone mineralization. That's very, very important. The second very important thing is pay very close attention. So maintain your level of activities. Reducing that because you feel at risk is, again, the wrong direction to be going in. You have to maintain your activity levels because these activity levels appropriately load the bone, and bones need this loading in order to be healthy overall. So if none of your activities have been causing discomfort, I would say absolutely maintain your activity levels. However, there is a third piece to this, and that is if you have maintained your activity levels and find that you have developed specific bone pain or specific joint pain that's new, that you never had before, that really wasn't there prior to your diagnosis or an old injury. So this is something that you're saying, my back is sore now, my hip is feeling more sore, I'm really feeling a bit of pain in my ribs. Do not ignore those warning signs. Pain is the first and foremost symptom associated with bone that might be deteriorating to a point where it would be at risk for fracture. So this is a very, very important sign. Don't ever ignore that pain, assuming it's just exercise pain. If it's exercise pain, it'll likely be more muscular than it is in the bone or in specific joints, particularly, again, if this is new pain. And I think the third or fourth element that you have to address is to receive appropriate guidance. Not all forms of exercise are recommended when you have bone health issues. Many exercises are designed in order to strengthen your muscles, and many personal trainers, many gyms have put together apparatus and machines that are really designed to maximize the strength of your muscles, but they don't necessarily take into consideration what stress might be being put on your bones. And you need that expert help at the time that you have realized or you know that your bones are at greater risk. You need to see a physiotherapist or a trainer who has had experience with patients who have had bone health issues and who have cancer. And again, very, very specifically, it is not all personal trainers, it is not all gymnasiums, it's not all people who have an expertise in exercise who will be able to appropriately direct you at this point in time when you may have a bone health issue. And I think that's very important. Certainly nutrition is extremely important at this point in time as well. I'm not a nutritional expert, but seeking appropriate nutritional guidance, again, is something that you can do for yourself. And again, maintaining activity levels. There are many things that you can do without any supervision, and that is walking, potentially cycling, swimming. Many of these things do not overly load the bones themselves, and it would be very difficult to do that unless you were running marathons. And so I recommend that you maintain your activity levels by all means. So in summary, just to look at what can I do, many of the things you can do on your own without necessarily running to your health professional. Obviously, you need the health professionals in order to determine the location of where your bones may be at greater risk, whether it's the spine or with the long bones in your leg or your arm. You need to know that as well. You need to know the location of where your bones are at greater risk. As an example, if it's your upper limb, you can do anything you please with your legs. If it's your lower limb, then you can do anything you please with your upper limbs. So there's a selectivity here that you and a self-guidance that you need to put into place when you know that you're at greater risk or have been determined to be at greater risk for your bone health.